What are the costs of bladder treatments at urology clinics? If you are wondering about the costs associated with bladder treatments at urology clinics, you are not alone. The expenses can vary greatly based on several factors. These include the type of treatment needed, the complexity of the condition, where the clinic is located, and your insurance coverage. First, let's talk about diagnostic costs. When you visit a urologist for an initial consultation, you can expect to pay a moderate to high fee. This fee can change depending on the clinic's pricing structure. If diagnostic tests are required, such as cystoscopy, urine cytology, or imaging tests like ultrasounds or CORT scans, these will add to your overall costs. A cystoscopy alone can range from several $100s to over $1,000. The price often depends on whether anesthesia is used during the procedure. Next, we have surgical treatments. One common procedure is the transurethral resection of bladder tumor, also known as TURBT. This procedure is often used for non-muscle invasive bladder cancer. The cost for TURBT can range from several $1,000s to tens of thousands of dollars. The exact price will depend on whether the procedure is done in a hospital or outpatient setting, as well as anesthesia and pathology fees. More complex surgeries, such as cystectomy, which involves removing the bladder, can be significantly more expensive due to the required hospital stay and the complexity of the surgery. Intravesical therapies are another treatment option. This involves placing medication directly into the bladder. For instance, intravesical chemotherapy or immunotherapy treatments like mitomycin instillation, usually requiring multiple sessions. Each session can cost anywhere from a few hundred to a few $1,000s, depending on the medication used and where the treatment is administered. Some newer therapies may have higher initial costs but could save money in the long run by reducing the number of clinic visits needed. Follow-up care is also an important consideration. Patients with bladder cancer often need ongoing surveillance, which includes periodic cystoscopies and urine tests to check for recurrence. These follow-up visits can accumulate significant costs over time. Insurance coverage plays a crucial role in determining out-of-pocket expenses. Many insurance plans do cover bladder cancer treatments, but the exact costs will depend on your specific plan, including deductibles and co-payments. Some clinics may offer payment plans or financial counseling to help manage these costs. Lastly, there are emerging trends in treatment. Recently, the Food and Drug Administration approved home-based administration of mitomycin for certain bladder cancer patients. This could potentially lower costs related to clinic visits and improve convenience for patients. In summary, the costs of bladder treatments at urology clinics depend on various factors, including the type of treatment, location, and individual patient circumstances. Surgical procedures and repeated therapies are often the most significant cost drivers. It is always best to consult with healthcare providers and insurance representatives to get personalized estimates and financial guidance.